Prabhakaran from the University of Technology, Malaysia. On behalf of BIONANOSEM 2022, I would like to share my insight on the application of nanotechnology in the treatment of women cancer. Female-specific cancers, as we know, are the most common cancers in women worldwide. The prevalence in developing countries continues to increase rapidly. This could be due to the unavailability of early detection methods for most of these cancers. Hence, these cancers are often diagnosed at later stages. Apart from that, the increase in number of cases could also be due to the lack of financial resources and the unavoidable risk factors of this disease. To date, these cancers are mostly treated via traditional means of anti-cancer therapy. However, these therapies are compromised by reduced drug potency, non-specificity, adverse side effects, as well as multi-drug resistance. And with this, it makes the anti-cancer therapeutic efficacy decreased, or it does not last for a long time. We will look into three different types of women cancers. So first we have the breast cancer. In 2020, breast cancer has been recorded as the most frequently diagnosed cancer in the world, which accounts for about 11.7% of the total cancer cases. Then we have the cervical cancer, which is the fourth most common female cancer after breast, colorectal, and lung cancer. In 2020, about 600,000 new cases were emerged and 340,000 death cases. And then third, we have the ovarian cancer. Ovarian cancer is the eighth most common cancers globally. However, it is the deadliest cancer among women and also the second most frequent malignancy in women over 40 years old after breast cancer. Okay, breast cancer can be caused by various factors. However, the main reason could be the mutation of BRCA1 and BRCA2 gene. It is positioned or located at the chromosome 17 and chromosome 13. So apart from gene mutation, alcohol consumption, smoking, obesity, minimal breastfeeding or no breastfeeding at all, late menopause, late age at first pregnancy could also be some reasons of obtaining or getting breast cancer. Breast cancer can be divided into four major groups or subtypes, in which the luminal A is the least invasive type of breast cancer and also is the most common type of breast cancer among women. It also has the best prognosis, least invasive, and also a better set of treatment available for this sort of breast cancer. On the other hand, we have the triple negative subtype, which is known to be the most invasive subtype. It comprises about 13% of all breast cancer cases, and it often is diagnosed in women at younger age. And it also has worse prognosis. It's known to be enriched with cancer stem cells, making it difficult to be targeted and also to be treated. Next, we have the ovarian cancer. So ovarian cancer has got very similar risk factors as the breast cancer. So it is also caused by gene mutation, similar to breast cancer. the BRCA1 and BRCA2. So the issue with ovarian cancer is that it shows no symptoms at early stages, but only is detected at later stages. And ovarian cancer has the lowest survival rate of any female cancer type. Only about 44% would survive after the diagnosis and also treatment, and from there only about 5 years of survival uh, rate for those have been diagnosed with ovarian cancer. So all this would make or makes ovarian cancer a silent killer among women. All right, let's see. What is cancer nanomedicine? So cancer nanomedicine is where nanotechnology plays a major role in the treatment of cancer. So there are various types of nanomaterials used currently or available and has shown promising effects in various parts in treating cancer. So these nanomaterials are very helpful in uh, providing us with significant diagnostics procedures or methods, and then targeting of antibodies, small molecules, peptides, and also therapeutics such as radiotherapy, immunotherapy, ablation, and gene therapy. So why are these nanomaterials or particles very significant? Well, it is known to be have tailored size and conformation. It has got significant encapsulation capacity. It's got high adhesion to the cancer environment, have got selective localization, meaning it is able to penetrate and reach the particular area where the tumor is and needs treatment. It also has got enhanced cancer internalization, which means it is able to penetrate the cancer or the tumor cell where the treatment or the targeted treatment is to take place. Next, nanomaterials or particles have got sustained and controllable drug release capacity. So it is able to hold and control the drug release in the tumors for a more significant effect of the drug. Apart from that, it also has got long half-life cycle. It has got very minimal systemic toxicity, and it is eliminated safely. So this diagram here shows the comparison between the conventional and nanotechnology based treatment. So if you see, the conventional often causes systemic side effects. Patients are introduced to harmful radiation, that is drug resistance, acquired resistance, and also often only allows late stage diagnosis, which means it's not so sensitive to be able to detect presence of tumor or any cancer particles, cancer related molecules expression at an early stage. On the other hand, the nanotechnology enhanced treatment allows or provides us with enhanced imaging capacity, faster diagnostic methods. It decreases the exposure of radiations, theranostics. Apart from that, it also allows targeted delivery of the drug encapsulated in nanomaterials into the targeted site. It offers lower toxicity compared to the conventional, and yes, it also increases the efficiency of the therapy or the therapeutics used. So as a whole, the application of nanotechnology in treating these cancers, any cancers in general, reduces side effects significantly, allows selective drug delivery to only the targeted site, and also it gives us enhanced therapeutic compound uptake. So these compounds which are probably not easily taken up in the conventional therapy or treatment option is actually taken up more significantly and enhances the anti-cancer effect. So this figure here shows the application of nanotechnology in treating a specific type of cancer. So this often happens in any female cancers as well as other cancers also. Okay, so you see here that this area here is the tumor, and then you have the normal cells or the healthy cells which are not tumorigenic. So these tumors are targeted specifically by encapsulating a specific drug into a nanocarrier and injecting it into the targeted site. And with this, with the nanocarrier and the nanomaterial significant properties, it is able to penetrate into the tumor cells and do its job by interfering with the tumor microenvironment. Could be the breast, it could be the ovaries, it could be the cervix, or any part of the organ which is affected. So it affects the tumor microenvironment, leading to various inhibition of the cancer pathways. So via this interference or interfering with these cancer pathways or signaling, the drug or the drug encapsulated in nanocarrier is able to inhibit angiogenesis, okay, metastasis, reducing the multi-drug resistance, inhibits uncontrolled proliferation, signaling, and also the cancer metabolism. Here is an example of a nano encapsulated curcumin, you will see, which has been used to treat the triple negative breast cancer cells. So triple negative breast cancer cells are known to be enriched with cancer stem cells and often induces the epithelial mesenchymal transition, which in turn causes metastasis or aggravates the metastasis process. Okay, on the other hand, curcumin, if you see, has got significant anti-cancer properties, but the drawback with curcumin is that it has got very poor solubility and bioavailability. So here we see that it has been encapsulated into a nanocluster, producing, okay, or any nanomaterial here producing a nanocomposite in order to actually treat this triple negative breast cancer. So via this, it actually inhibits the epithelial mesenchymal transition, but in turn activates ROS, and which leads to apoptosis. So with the involvement or application of nanotechnology, it is able to resolve the problems of curcumin to be delivered into the cancer cells via packaging into a nanosystem, nanocomposite system. Apart from that, we also have a few nano-related drugs for breast cancer which are in clinical trials currently. So one of it is the liposomal dogs and PEG-related liposomal dogs nanoparticles, which are in phase 2 and 3. And then we also have the methotrexate albumin nanoparticle conjugates. albumin, paclitaxel nanoparticles as well. Okay, for ovarian cancer, it's quite similar if you see. So as ovarian cancer is quite lethal and is only detected at if it is detected at a later stage, there are a number of treatments, of course, via nanotechnology application, but this only allows to prolong the survival rate. It cannot eradicate the tumors much. It could just stop as it's already at a later stage. However, in the detection stage or detection for detection methods in ovarian cancer, it definitely has shown or is very promising, as it is able to actually detect the presence of ovarian cancer at an early stage. So that is very helpful with the presence of nanotechnology application or as a diagnostic tools for early detection in ovarian cancer. So how is it done? So via these detection methods, which is mainly molecular imaging, it is able to identify the tumor cells based on the genetic mutations and also the functional characteristics. So with this imaging or detection method allows for significant visualization and monitoring these cancer cells at actually various specific stages of the tumor development. So via this, the physician can actually plan or manage or decide the type of treatment and in order to manage this type of cancer. And then last we have the cervical cancer. Okay, which is also so here it shows an example of nano vaccine, okay, which has been used in treating cervical cancer. So studies have shown that nanoparticles loaded with a particular drug, here dogs, have higher cytotoxic activity compared to a non-nano encapsulated drug. And also curcumin loaded, okay, again we see curcumin, okay, loaded into a nanoparticle and conjugated with an antibody was also beneficial against multi-drug in cervical cancer. So we can see that the existence or the presence of nanotechnology here has major beneficial